Track 11. Summary of consultation questions. This track is approximately 11 minutes long. Summary of consultation questions. Chapter 1. PIP. Overview on Assessment Reform. Question 1. What are your views on an assessment that places more emphasis on condition rather than the functional impact of a condition on the person? Question 2. What are your views on people receiving PIP without an assessment if they have specific health conditions or a disability as evidenced by a healthcare professional? Question 3. What are your views on PIP claimants not being subject to an award review if they have a specific health condition or disability as evidenced by a healthcare professional? Question 4. Do you agree or disagree on making provision of evidence or a formal diagnosis by a medical expert a mandatory requirement for eligibility for PIP? Agree, disagree, don't know. Question 5. In relation to question 4, please explain your answer and provide evidence or your opinion to support further development of our approach. Question 6. How could we prevent the provision of evidence or a formal diagnosis by a medical expert from impacting the NHS? Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 7. Do you agree or disagree that eligibility for PIP should be based more on condition? Agree, disagree, don't know. Question 8. How could we determine eligibility for the following conditions? Conditions that fluctuate. Conditions that vary in severity. Conditions that might be cured or have access to better new novel treatments over time. Please explain your answer and provide evidence or your opinion to support further development of our approach. Chapter 2. PIP. Eligibility Reform. Question 9. Do you think the need for an aid or appliance is a good/bad indicator of extra ongoing costs and why? Question 10. Do you think the need for prompting is a good/bad indicator of extra ongoing costs and why? Question 11. Do you think people who accumulate low points across activities have the same level of extra cost as those who score highly in one or more activities? Question 12. Do you think any of the PIP activities measure similar functions and could be merged? Question 13. Do you think any of the PIP activities should be removed or rewritten and why? Question 14. Should we consider adding any new activities? If so, which activities should be added and why? Question 15. Do you think the current entitlement threshold levels are set at the right levels to define the need for government financial support and why? Question 16. What are your views on changing the length of the current 3-month qualifying period for PIP, which is used to establish that the functional effects of a health condition or impairment have been present for a certain time period before entitlement can start? Question 17. What are your views on retaining, removing or changing the length of the current 9-month prospective test, which is used to determine if the functional effects of a health condition or impairment are likely to continue long term? Chapter 3. PIP. What do we provide support for? Question 18. PIP provides a contribution towards extra costs. Which extra costs incurred by disabled people are the most important for a new scheme to address? Please rank the following options in your order of importance. Equipment and aids, medication and medical products, personal assistance, costs arising from hard physical and/or emotional support within and outside the home, e.g. help with household tasks or assistance with transportation. Health and personal care, including physical therapies, talking therapies, massages, etc. Also includes greater spending on personal hygiene or appearance. Extra transport costs, from reliance on taxis or accessible taxis, hospital parking fees, vehicle adaptations, etc. Additional energy and utility costs arising from disability or health condition, including digital access. Additional food costs arising from disability or health condition. Additional spending on clothing, footwear and bedding items arising from disability or health condition. Higher costs of insurance. Additional housing costs arising from disability or health condition, including home adaptation costs. Question 19. In relation to question 18, please explain your answer below and tell us about any other important kinds of costs not listed above. Question 20. What are the benefits and disadvantages of moving to a new system for PIP claimants? A catalogue/shop scheme. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 21. What are the benefits and disadvantages of moving to a new system for PIP claimants? A voucher scheme. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 22. What are the benefits and disadvantages of moving to a new system for PIP claimants? A receipt-based system. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 23. What are the benefits and disadvantages of moving to a new system for PIP claimants? One-off grants. Benefits, disadvantages, other. Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 24. If PIP could no longer be used to determine eligibility to passport to other benefits and services, what alternative ways could service providers use to determine disability status? Question 25. If PIP could no longer be used as the eligibility criteria to additional financial support in universal credit, what alternative ways of determining eligibility should we use? Question 26. Are there any specific groups of people whose needs are not being met by the current PIP provision and have a need for a greater level of support? What form should this support take? E.g., help with specific extra costs, access to improved healthcare such as mental health provision, or enhanced local authority support such as care packages and respite. Question 27. Instead of cash payment, are there some people who would benefit more from improved access to support or treatment? For example, respite care, mental health provision or physiotherapy. Chapter 4. PIP. Aligning support. Question 28. Do people already receive support from local authorities or the NHS with the need/costs that come with having a disability or health condition? Yes, no, don't know. Question 29. In relation to question 28, please explain your answer and provide evidence or your opinion to support further development of our approach. Question 30. Which of the following do local authorities or the NHS help with? A. Equipment and aids. B. Medical products. C. Personal assistance, e.g. help with household tasks. D. Health services. E. Social care. F. Respite. G. Transport. H. Utility costs. I. Other. Question 31. In relation to question 30, please explain your answer and provide evidence or your opinion to support further development of our approach. Question 32. Which needs/costs that come with having a disability or health condition could local areas help with further? A. Equipment and aids. B. Medical products. C. Personal assistance, e.g. help with household tasks. D. Health services. E. Social care. F. Respite. G. Transport. H. Utility costs. I. Other. Question 33. In relation to question 32, please explain your answer and provide evidence or your opinion to support further development of our approach. Question 34. If we align the support offered by PIP into existing local authority and NHS services, how could this improve things for disabled people and people with health conditions? Question 35. Do you think aligning PIP PIP with local authority and NHS services could reduce the number of assessments a person with a disability or health condition would have to undergo. Would this help to reduce duplication? Question 36. What disability support services in your community are the most important services or support to deliver? Question 37. How much flexibility should local areas have to decide their priorities in supporting people with disabilities and health conditions? Question 38. What capacity and capability would be required to better align PIP with local authority and NHS services? Compulsory question. Question 39. Are you an individual or an organisation supporting claimants applying for PIP? This concludes Track 11.